program is still new on Otonjo this Monday morning, the 4th of March 2013, and we are now being joined by the Commissioner for Health in Ogun State, Dr. Olaokun Soyinka. Of course, we did tell you that the National Immunization Plus exercise got underway on the 2nd of this month, and it will be ending on the 5th of this month, which is tomorrow. And so we have decided to bring him on the program this morning to highlight to us the possible challenges they have encountered since the program got underway some 2-3 days ago, and what more, or which area is still requiring attention in terms of coverage and other issues he may wish to talk to us about as far as polio vaccines are concerned. Dr. Olaokun Soyinka, good morning.
Good morning.
It's nice to have you with us this morning.
It's my pleasure.
Now, everyone will have the opportunity of interfacing with the Commissioner for Health in Ogun State at the appropriate time, but all we ask of you is just to let us set the agenda first for this discussion, that you can begin to make your own interventions based on the agenda we probably will have set for you this morning. We have Ola Williams still on the program.
Ẹyẹ wa mo kí káàbọ̀ padà sórí ètò yín ètò wa ọ̀tún ọjọ́ láti lè ṣe tẹlifíṣàn ti ìpínlẹ̀ Ògùn nílùú Abẹ́òkúta. Ní báyìí wọ́n ní ìlera lóògùn ọrọ̀. Ẹ̀yin dẹ̀ ni ó ń di àkùkọ torí pé ọwọ́ ọmọdé ò tó pẹpẹ táwọn àgbà náà wà kèrègbè. Àṣàwò àwòdìwò ń ta bá jìjọ wò gígùn ló ń gún. Ìlàkàkà ìjọba orílẹ̀-èdè Nàìjíríà pàtàkì jùlọ ìjọba ìpínlẹ̀ Ògùn láti rí pé àrùn rọmọlápá lẹ́sẹ̀ ó kúrò jákèjádò ìpínlẹ̀ Ògùn àti ẹgbóòrùn ẹ̀mọ́ kò sí nílẹ̀ Nàìjíríà náà pàápàá kí gbogbo àgbáńláyé kí wọ́n wà nínú ìrọ̀rùn. Ìjọba yìí wọ́n ń ṣe gudugudu méjì àti yàyà tí ò lóǹkà láti rí i pé ipa tí wọ́n ń sà lórí fífún àwọn ọmọ kéékèèké ní abẹ́rẹ́ àjẹsára èyí tí yóò lé àrùn ọmọlápárọ̀ lẹ́sẹ̀ lọ ó yọjú sí èbúté ayọ̀. Ìdí rèé tí a fi gbé alábòójútó fún ètò ìlera nípínlẹ̀ Ògùn ìyẹn oníṣègùn òyìnbó oníṣègùn Olaokun Soyinka wá sí orí ètò. Wọ́n pe kíní kan ní immunization polio immunization plus èyí tó ti bẹ̀rẹ̀ ní ọjọ́ kejì oṣù táwa nú èyí tí yóò parí ní ọ̀la. Ẹ ní àǹfààní láti bá alábòójútó fún ètò ìlera nípínlẹ̀ Ògùn ẹ láǹfààní láti bá wọn sọ̀rọ̀. Ìbéèrè ní ọ̀rọ̀ àmọ̀ràn ní àkíyèsí ní ẹ ní àǹfààní láti sọ. Àmọ́ mọ̀ pé láìpẹ́ láì jìnnà nǹkan bí oṣù kan àbí bí ọ̀sẹ̀ mélòó sẹ́yìn immunization plus yìí náà ó wáyé. Ṣé bí ó ṣe máa wá ní ìpele nípele ṣé bó ṣe máa wá rèé kí làwọn ìpèníjà tó wà ń bẹ. Àwọn tí wọ́n ń ṣe kinní yìí ṣé wọ́n mọ̀ nípa ẹ̀ dáadáa, yẹn ni pé àwọn tó ń fún àwọn ọmọ kéékèèké ní abẹ́rẹ́ àjẹsára yìí tí a ń sọ ǹjẹ́ wọ́n mọ̀ nípa ẹ̀ dáadáa, àti pé ṣé abẹ́rẹ́ yìí pàápàá ṣó pọ̀ tó ní ìpínlẹ̀ Ògùn láti lè fún àwọn ènìyàn. Àwọn àdúgbò wo ni àrùn yìí ni wọ́n sì ń kẹ́fí ẹ̀ àbí akàn ń ṣe pé ó dáa àti ṣe gbogbo ẹ̀tọ́ ká lè wẹ̀ káyọ́ kọ̀ọ̀kan pé lóòótọ́ ó dára lójú pé kò sí ní tí wọ́n tún ń ṣe yìí. Bí a bá ti wá ṣe kinní yìí ìjó tún máa ń padà láti tún mì sẹ́yìn, ìyẹn ni pé wọ́n á ní iyán tí àwọn pé yán ewùrà kò sí bá ẹ fẹ́ ṣe tí ò ní mí, ṣé kinní yìí tún máa ń mí sẹ́yìn àgbà ó máa tún ti yọjú ńgbà kan o lẹ́yìn tá a ti ṣe àwọn ìgbékalẹ̀ àti àwọn ìgbésẹ̀ láti lè lé àrùn yìí kúrò, ṣó tún ṣe ń padà yọjú síta. Ọ̀pọ̀lọpọ̀ àwọn nǹkan wọ̀nyí ni a gbìyànjú láti béèrè lọ́wọ́ alábòójútó fún ètò ìlera ní ìpínlẹ̀ Ògùn ìyẹn oníṣègùn òyìnbó oníṣègùn Olaokun Soyinka. Lórúkọ yìí tẹ̀ wá lé lórúkọ àwọn táwọn àbí mo kí oníṣègùn òyìnbó Olaokun Soyinka alábòójútó fún ètò ìlera nípínlẹ̀ Ògùn kí wọ́n káàbọ̀ sórí ètò ọ̀tún ọjọ́. Alábòójútó wa kí wọ́n káàbọ̀ sórí ètò.
Now, Honorable Commissioner, let's get started this way. Some 1 month ago, we actually had the opportunity of interfacing with the World Health Organization representative in Ogun State here, Fajen Gbese, a medical practitioner also. And it did highlight one thing that is essential: the attitude of vaccinators to effective coverage of spotted area, dark spots, as far as polio eradication is concerned. That is the most essential of all the process. Is the situation still as is said at that point in time, as of today?
I don't think so, because one of the hallmarks of the polio program is that you constantly assess how it is going day to day. Like for instance, on Saturday, I was able to go to sit through a review meeting where all the vaccinators, the head of the vaccination teams in that local government, the heads of each ward, will come and report about challenges that are being faced. They report immediately, and then those are relayed. Usually the local government chairman or the health officials are there from the local government, and of course the immunization officials. So immediately they take steps to remedy those problems. So for example, if there's an area that, as you mentioned, is like a dark spot, it's difficult to go, it may be because it's hard to access. Like where I was in Remono, there was a collapsed bridge. They couldn't go to the bridge. So when they bring that to the meeting, they can try and get some extra money released. Then they take transport and they go the long way around, not having to go over the bridge. Other reasons can be security. It's not obviously as bad as we read about it in the north, but still there are some places where maybe it's a bit dangerous to go, maybe dens of armed robbers or generally a bit of a ghetto. And vaccinators are not keen to go there, so we have to hire extra security and things like that. But the main point is that when we identify a problem, it is immediately dealt with to make sure that we eradicate all areas where there are children who have not had the vaccine. Because once there are children, that is unvaccinated children, that is the avenue through which the virus can come in, to infect the children, and then can pass to other children.
Now, as far as poliomyelitis is concerned, Ogun State was reported recently to actually had a clean bill of health as far as coverage is concerned. What then will have necessitated this National Immunization Plus exercise? Does this suggest that there are cases of possible infection?
Well, not that there are cases, but you see, there is no time you can be sure you are totally protected. If Ogun State, and of course the aim is to eradicate polio totally. So if you're going to do that, you must run these programs across the nation. You can't say, oh, this part of the country is fine, so we don't need to do it again there. Children are being born all the time, and of course there are always children who have not been immunized or not had adequate immunization. But as long as they are very few, and the only way to keep it at a very small number is to keep having these programs. It is not actually true to say it's the only way, because of course what we are trying to do is to get to a situation where all parents are taking their children to have their routine immunization. You know, when the child is born and at the intervals as prescribed, all children will be protected. And once we get to that stage where our routine immunization is so widespread and everybody is so aware of it that the children are pretty much all immunized from birth, then these programs won't be so necessary.
Now let's take a look at Ogun State, the strategic placement of Ogun State as a gateway to a number of states and even neighboring countries. This in itself poses a challenge. I do not know how you've been able to factor this into your operations and processes such that as it serves as a gateway to a number of states and 1, 2, 3 neighboring countries, the incidence of new upsurge do not in any way erase or make rubbish of the record that Ogun State already has in polio eradication.
That is why we are saying we can't relax. As you said, we have been polio free for a while, for 3 years, and the danger is, however, that traffic passing through, people, visitors, people transiting through the gateway state that we are, bring the virus into the state. In fact, a while back, environmental scientists who sometimes check in the surroundings to see what viruses and germs they find there, they found the polio virus in Lagos, but it was in the dirt. Meanwhile, there was no case of polio. Now that tells you that anybody around, all the children around that area, because they were protected, that virus could not get into anybody. So that is what we're aiming for. Anybody bringing the virus from elsewhere, we want all our children to be protected so it cannot come into the state. We must do our bit to keep Ogun State polio free. If all other states do their bit to keep themselves polio free, then of course Nigeria will eventually, well, hopefully, as the president has set the target for this year, hopefully we will succeed in driving it out of Nigeria this year. So we do our job and others will do theirs.
So December this year is the target date?
That is the target.
How realistic is that nationally?
It is quite realistic. I mean, it is realistic. These campaigns around the country, we have done 2 this year already. We're going to have maybe some what we call LIDs, local immunization days, later on in the year. But we won't be part of the national program. This is the last one we're doing as part of the national program, the door-to-door. But in the northern states, they're going to have a lot more national immunization days for them. And hopefully that's going to, they're already bringing it back down up in the north. I think it's only about 60 cases so far this year. So I think it's very realistic. We shall succeed. We can't be last. You know, there were 4 countries, Pakistan, Afghanistan, India, and Nigeria. Now India has a 1-year polio free. So it's gone from pain to pan. And what our aim is, it will go from pan to par. That means the end of Nigeria will be out of it because we will be polio free. That's the aim.
Gẹ́gẹ́ bá ti ṣe àlàyé lẹ́ẹ̀kan mo ní ìlera lóògùn ọ̀rọ̀, àwọn ògo wẹrẹ wa, àwọn ní ọjọ́ iwájú wa, àwọn ní ọjọ́ ọ̀la. A gbọ́dọ̀ gbìyànjú láti rí i pé wọ́n wà nínú ìrọ̀rùn, ìlera wọn ó péye lásìkò yìí. Ìdí èyí tíjọba ìpínlẹ̀ Ògùn àti ọba àpapọ̀ ilẹ̀ Nàìjíríà àpapọ̀ àti wọ́n fi ń làkàkà láti rí i pé àrùn rọmọlápá rọmọlẹ́sẹ̀ wọ́n lè jáde pátá nílẹ̀ Nàìjíríà, pàápàá jùlọ nípínlẹ̀ Ògùn, kó má sì mọ́, kò sì ní sí láyé àti láéláé. Alábòjútó wa ó ní mo fẹ́ bèrè ní pé tí a bá wò ó dáadáa, àwọn àrùn kan wà tó yẹ pé wọ́n máa ń jẹyọ bí wọ́n bá lo oògùn bà, bí bàbá tún jẹ́ a tún níbà, ìyẹn malaria fever ṣe é mọ́ bà. bí wọ́n bá lo oògùn jẹ̀dí tó bá tún pẹ́ jẹ̀dí tún sì lè ṣẹ́ nìyẹn. irú polio yìí bí wọ́n bá ti gbà ṣó lọ nìyẹn, kò lè tún jẹyọ padà pé ó dàbí pé polio yìí tún yọ lára ọmọdé yìí, ṣé yẹn ò lè yọ? ìyẹn ìkíní. ìkejì, àwọn èèyàn wa tí wọ́n wà ní gbèríko tí wọ́n láǹfààní ní gbogbo àsìkò tí ọmọ wà ní ọmọ ọjọ́ kan títí di ọmọ ọdún 5 àbí láti gba kinní yìí, tọmọ ọdẹ ti tó bí ọdún 10 13, ṣé kinní yìí ò lè jẹyọ lára ọmọ yẹn mọ́?
Ok, ẹ ṣe.
ó jẹ́ ìbéèrè méjì.
Ó ti yé mi. Ṣé nǹkan tí ó wà nídìí ìbéèrè tẹ kọ́kọ́ béèrè yẹn ni pé ìyàtọ̀ wà nù pé èèyàn kàn jẹ oògùn láti parẹ́ àìsàn rẹ̀ lára àti nǹkan tá à ń pè ní vaccination tàbí immunization. Ṣé rí immunization yẹn, ṣé mọ̀ pé nínú ọ̀rọ̀ yẹn immune wà ń bẹ̀. Immune yẹn ni pé agbára ara wa
àjẹsára láti
dènà àìsàn. So nǹkan tó wà níbẹ̀ ni pé abẹ́rẹ́ àjẹsára tó ń fún àwọn ọmọ yẹn kì í ṣe pé ó ń pa polio. Nǹkan tó ń ṣe ni pé wọ́n ti ṣe nǹkan tó jọ polio sínú ẹ̀, tó bá ti wọnú ara wa ó máa lera so that tí kòkòrò tó ń fa polio yẹn tó bá wọnú ara wa, àwa la máa pa, ẹ̀jẹ̀ wa ló máa pa.
yàrá pé tinú yẹn gangan ló máa dojú kọjá títa yẹn pé ìpínlẹ̀ àti ìwé pé kó fèsì ẹ̀ lọ́wọ́ kan ni.
kì í ṣe pé oògùn ni ó ń fún wa ní agbára láti lé kòkòrò yẹn jáde tó bá bọ́ sínú, tó bá yọjú sí tó bá wọnú bóyá tàbá tó bá wọnú ẹnu wa, tó bá ti wọnú ẹ̀jẹ̀ wa. So ìyẹn ni à ń pè ní immunization. Ìyẹn dẹ̀ ni à ń sọ fún àwọn àbí abẹ́rẹ́ àjẹsára. Ìyẹn là dẹ̀ ń sọ fún àwọn ìyá àbí àwọn bàbá kan gbé àwọn ọmọ lọ sí ilé ìwòsàn alábọ́dé àbí general hospital bí tí wọ́n ti ń ṣe immunization, kọ́ máa fún àwọn ọmọ ní abẹ́rẹ́ àjẹsára fún àwọn oríṣiríṣi àìsàn tó máa mú ọmọ kékeré kó dènà gbogbo àwọn àìsàn yẹn kọ́ balẹ̀ ní àlàáfíà. Ìbéèrè kejì ni pé
ọmọ tó ti dàgbà
kì í sábà ràn wọ́n, àwọn tí wọ́n ti lera dáadáa kì í sábà ràn wọ́n. Tábà ti fún àwọn ọmọ tí wọ́n pé ọdún 5, tábà ti fún gbogbo àwọn yẹn ní àwọn abẹ́rẹ́ àjẹsára yẹn, ó ti wà pa nìyẹn. Kòkòrò yẹn lè wà lára àwọn ọmọ tó bá ti dàgbà sí àyífún àgbàlagbà, ṣùgbọ́n kò lè ràn ọmọ kékeré tó àwọn ti gba abẹ́rẹ́ àjẹsára yẹn, so wọ́n ti wà protected, so kò ní ràn wọ́n. So iṣẹ́ ta nídìí láti ṣe nìyẹn, ká kàn fún àwọn ọmọdé omi pé kòkòrò tó ń fa polio yẹn pé ó máa kúrò ní Nàìjíríà, kò ní rí bí há sí, kò ní rí ẹni tó máa lè ràn mọ́. So nǹkan tá à ń ṣe nìyẹn.
Tábà wò pẹ̀lú kíní àtọ́lá yìí ṣó pọ̀ tó?
Ó pọ̀ tó, kò lè tán lọ́wọ́. Ìjọba àpapọ̀ ni wọ́n ra kíní ẹ̀, ni wọ́n rà ní bulk, ni wọ́n wá pín fún gbogbo àwọn ìpínlẹ̀. So ó ti pọ̀ nílùú báyìí, èyí taba need ó ti wà nílẹ̀, kò sí wàhálà.
báwo yàrá bá bẹ̀rẹ̀ sí ní bímọ tán lọ bímọ bí 20 tọmọ lọ yapa gan níbi ẹ̀ ti parí immunization lọ́la lọ́mọ bá yapa rẹpẹtẹ ṣé.
bíbímọ nìkan kọ́, ní gbogbo àwọn local government tó wà lẹ́gbẹ̀ẹ́ nítòsí Èkó, wọ́n máa ń ṣe mọ̀ pé àwọn ará Èkó wọ́n ń kúrò lẹ́kọ̀ọ́, wọ́n ti wá gbé ní Ogun State. So our population yẹn ti ń pọ̀ sí, ó ti ń pọ̀ sí. Tábà ti gbé táwọn tó ń pé ẹ̀tọ́ fún àwọn ọmọ ológun yẹn tó bá ti jáde, tó bá ti fún wọ́n máa ń kọ́lẹ̀ pé ọmọ mélòó náà fún. So wọ́n á ti kọ́ last time pé ok population tá a fẹ́ cover lélẹ̀ wọ́n á tún débẹ̀ wọ́n ní Ogun títán àwọn ọmọ ṣe ipò rẹpẹtẹ káàkiri of course torí àwọn tó ti ń move wọ Ogun State ni ṣùgbọ́n wọ́n á padà lọ sí headquarters wọ́n á tún gba Ogun sí wọ́n á tún jáde wọ́n á tún lọ fún àwọn ọmọ tí wọ́n miss yẹn so kì í ṣe pé ó fa problem ó lè fa problem díẹ̀ but Ogun yẹn wà so ká tún jáde padà títorí náà la ṣe máa ń pé mo sọ lẹ́ẹ̀kan pé a máa ń ṣe nǹkan tá à ń pè ní local immunization days so a mọ̀ pé àwọn ọmọ kan wà tó yẹ pé àyè máa miss wọn even nínú ètò yìí tí wọn ò ní gba abẹ́rẹ́ àjẹsára.
lásìkò yẹn nìyá wọn gbé wọn kúrò níbì kan lọ síbòmíì.
so tá a bá ń ṣe nǹkan tá à ń pè ní local immunization day tí gómìnà wa wọ́n máa ń fún wa ní owó pé àìlọ́ ṣe ètò kékeré kan kẹ́ polongo ẹ̀ ṣùgbọ́n kì í ṣe pé a máa ń lọ láti ilé sílé ìyẹn tá à ń pè ní local immunization days a máa polongo ẹ̀ ní a máa sọ fún àwọn parents pé kàn gbé àwọn ọmọ ẹ̀ jáde kàn wá bá wà ní ilé ìwòsàn kàn wá gba abẹ́rẹ́ àjẹsára so tá a bá ṣe yẹn tá a bá àdìẹ mọ ìta ń ṣe ń sìn then ọ̀pọ̀lọpọ̀ àwọn ọmọdé wọn ti gba abẹ́rẹ́ àjẹsára wọn dẹ̀ ti wà pa.
má bínú oṣù náà mo ṣe ń bọ̀ lọ́dọ̀ ẹ̀ tá a bá wò ní ṣókí wọ́n ní ọ̀pọ̀lọpọ̀ nǹkan máa ń ba nǹkan jẹ́ náà ni bí wọ́n bá mú omi jù ó lè ní lára ṣé abẹ́rẹ́ àjẹsára ṣé kì í pọ̀ jù àtọ́láì.
kì í pọ̀ jù ṣé ẹ mọ̀ pé àwọn abẹ́rẹ́ kan wà tá a bá gbà a máa ń gba káàdì pé wọn máa kẹ pé a ti gbà ẹ má tún padà lọ gbà ẹ má tètè padà lọ gbà ṣùgbọ́n eléyìí kì í pọ̀ jù a máa ń sọ pé kí ọmọ kí kíní ẹ kó wọ ara dáadáa ẹ̀mẹ́rin ni wọ́n ní ìdẹ ṣùgbọ́n tó bá kọjá mẹ́rin yẹn tó bá di márùn tó bá di ẹ̀mẹ́fà tó bá di ẹ̀mẹ́jìlá
kò ṣe léwu kankan
kò sí problem kankan rárá ó safe gan ni ó safe gan ni ṣé mo gbé nígbà kan wọ́n sọ pé kíní pé oògùn yìí ẹ má gba owó dé níjọ́ ó máa fa ilé ó máa fa yẹn but a ti ń fún àwọn ọmọ àti pé ẹ̀dẹ̀ rí pé kò fa nǹkan kan the only thing tó fà ni pé kò sí polio ní Ogun State so ẹjọ́ kí ẹ jẹ́ kí ọmọ yìí máa gbà ó.
Now, there is a likelihood of socio-cultural issues also affecting the widespread acceptance of polio immunization, of the younger ones. I do not know to what extent such factors have affected your own operations, particularly in this ongoing exercise.
We get very good feedback and statistics. You know, I mentioned these review meetings that are done, and when you do these review meetings, even when you do before the program, when they go out and they do what we call social mobilization, where they get the people together and they talk to them about the program and ask them their views and their feelings. So we have a lot of documentation about exactly who and why people in Ogun State don't take the vaccine. I'm happy to say it's very, very few, and those who do not want to take it, it's more that they need some more reassurance. It's not that they are fully determined that this is against their beliefs. In some pockets, there are people who, for religious reasons, maybe the pastor has decided that their own interpretation of the holy book is that, you know, it must be up to God whether you get it or not. You know, there are some few, people with some quite fundamentalist beliefs who don't want to take it, but it's so few, and even so we don't give up. We keep trying to explain to them that they have a duty, because you know, with polio, it's not about just whether you are prepared to allow your own child, you know, if it's the will of God, to get it. It's that your child poses a danger to everybody else, so you cannot make that decision to make your child a danger to others. So once we explain that and they understand that it's a public duty, most people, Ogun State doesn't have a major rejection problem.
Now, in occasional situations, you will have actually noticed, is it a situation of such individuals having it over and above the entire society, or the possibility of enforcement? Because where your action or inaction constitutes a great danger to your immediate environment, it's up to the government to insist. We won't allow your religious beliefs, your cultural beliefs, to pose further danger to what government spends millions, possibly billions of naira to execute. After all, it's in the overall interest of everyone. If eventually something bad happens, it throws back also at the government, because they'll be asking, government is there, it's not doing anything. So is it then necessary for us to begin to persuade, or to allow the process of enforcement to take place in such instances where we have people who are unduly recalcitrant?
I think the general feeling is that we shouldn't go right to the point of making it compulsory, you know, maybe making it a law. It's almost there as it is, because as you said, it's the right of the child, and legislation that is passed or that will be passed around various states and countries usually imply that denying a child vaccination is actually trampling on that child's human rights. So it's there in legislation, you can actually enforce it. But what the government is trying to do is saying, look, persuasion is working, information is getting through, and people are responding.
Okay.
So there's no need to get too heavy right now. Definitely, if it comes to the stage where some people are endangering eradicating it from Nigeria, people persistently, allowing the virus to get a foothold, then maybe the government may go that way. But right now, it's not necessary. It's going well.
Okay, I do know that the federal, the state governments, and some development partners and donor agencies are doing pretty well as far as collaboration is concerned for immunization. I do not know what level of support you get from the third tier of government, which of course is the closest to the people. Of course, it is essential. I will recall also that at the time we had paid advocacy visits to local government councils in this state. Do you get requisite support from these local government councils?
Well, I have to say on that score, the trend has been very positive. Exactly as you say, we've got support from the state, we've got support from federal government, we've got support from the partners. And for a while, I think the local governments were leaving it almost as if, well, somebody else is doing it, so this is one area we don't need to put our scarce resources. But as you said, we advocated strongly to them, and across Ogun State, I'm happy to say that all local government has responded, some more than others, but I think all are beginning to change their tune and to realize that every time there's a program and anytime we need to have activities around this polio eradication, they also chip in. They chip in with moral support. They chip in, for example, in my local government, and the local government chairman, he went out with the vaccination team. He and his exco, they went out vaccinating children, which is also something that sends a very good, powerful message. So even without giving money, some are giving a lot of moral support, but all are also chipping in money because it's such an expensive exercise. All tiers of government need to take part. And of course, we must, no matter how much you are doing, you can always do more. So we do urge local governments to still try and do a little bit more, especially when we come to do our local immunization days. But Ogun State, the local governments are performing very well.
Now, I also would like you to talk about the possibility of intervention from private individuals and corporate organizations. Polio eradication is one thing that benefits the larger society in the long run. If governments at all levels are doing the bit that they can do, is there the possibility of private individuals who have the wherewithal and corporate organizations also supporting you, or have you had instances of people voluntarily coming forward and saying, okay, fine, this is my vehicle, use it to navigate very difficult terrains, this is what I've got to support you, okay, I've got additional, what is it that it costs you to employ 3, 4, 5 support staffers, okay, let me support you with this? Have you had instances like that so that you can have a widespread coverage?
Here and there, individuals do help, and it very often is down to the activities or the energy that is put into social mobilization at the local government level. And then some individuals, through learning about the program, realize that there are also challenges, as you said, maybe just a vehicle or so a little bit of money for extra security. So they do chip in, but I would say that to keep this going, it will be good to see more efforts like that. I have to add, however, that one organization, Rotary International, has done a massive amount in supporting polio eradication across the world and in Nigeria. And of course, their money, a lot of that is from actually collecting together individual donations from their members. So in that sense, there also is a large scale coming together of private donations assisting the polio program. But I support that idea and ask individuals to also chip in when they see the programs coming to their local government, helping us at the local level.
If you are just joining us, we are playing host to the Honorable Commissioner for Health in Ogun State, Dr. Olaokun Soyinka, and we are taking a look at the National Immunization Plus exercise ongoing in the entire federation of ours and Ogun State with our immediate focus. We shall be going on this short break. When we return, Ola Williams will be here to take your calls in case you have questions, clarifications, or even comments to make about the exercise itself. The Honorable Commissioner for Health will be most willing to take all of your questions and provide accordingly. the responses that may be required of him as far as this exercise is concerned. Newdon Otonjo returns very shortly.
sórí ètò yín ètò wa ọ̀tún ọjọ́ láti lè ṣe tẹlifíṣàn ti ìpínlẹ̀ Ògùn nílùú Abẹ́òkúta. Gẹ́gẹ́ bá ti ṣe sọ, oníṣègùn òyìnbó oníṣègùn Olaokun Soyinka tí wọ́n jẹ́ alábòójútó fún ètò ìlera nípínlẹ̀ Ògùn, àwọn ni àlejò wa. Ó ti àsìn gbéyẹ̀wò òun ni ọ̀rọ̀ àtọ́lá, torí kì í ṣabẹ́rẹ́ mọ́ pàápàá àtọ́lá àjẹsára fún àwọn ògo wẹrẹ láti lé àrùn ọmọlápá lẹ́sẹ̀ polio kúrò ní ìpínlẹ̀ Ògùn àti nílẹ̀ Nàìjíríà. Nọ́mbà tí ẹ máa fi láǹfààní láti darapọ̀ mọ́ ètò yìí wọ́n á fi sójú ẹ̀rọ amóhùnmáwòrán wa. Ẹ lè láǹfààní láti béèrè ìbéèrè tàbí ọ̀rọ̀ àmọ̀ràn tàbí àkíyèsí. Kó tó di pé àwọn ìpè bẹ̀rẹ̀ sí ní wọlé, ẹ jẹ́ kí n béèrè lọ́wọ́ yín pé látìgbà tẹ́ ti bẹ̀rẹ̀ kínní yìí, ẹ ti bẹ̀rẹ̀ látijọ́ Sátidé, ó máa tán ní ọ̀la. Kí làwọn ìpèníjà tó yọjú? Àwọn òṣòro kéékèèké tẹ.
Àwọn tí mo sọ ní òyìnbó yẹn ni pé nǹkan méjì ni ó máa ń fún wa ní problem jù. Ìkíní ni àwọn ibi tí ó ṣòro láti débẹ̀, bí irú bí àwọn ibi kan tí mo lọ ní ọjọ́ Sátidé, wọ́n ní problem pé bridge kan wà tó kọjá lórí odò, bridge yẹn ti ṣubú, igi kékeré náà fi síbẹ̀, so àwọn tó ń gbé abẹ́rẹ́ kan ṣubú sódò, so ẹ̀rù ń bà wọ́n láti kọjá lórí kíní yẹn. So ìyẹn mi pé èèyàn láti fún un ní owó kan wọ transport kan gba ọ̀nà míì láti débẹ̀. So tó bá ti rí àwọn ìṣòro yẹn, tó bá ti padà wá sí headquarters, tó bá ti sọ fún wa, a máa rí bá ṣe máa yanjú ẹ̀. Ìkejì ní nǹkan security, ọ̀rọ̀ pé kí èèyàn máa lọ síbi tó yẹ pé bóyá pé àwọn armed robbers wà ń bẹ, àbí àwọn tó máa fún yàn ní tó máa léèyàn jáde sọ́kòlù yàn kankan bẹ́ẹ̀ yẹn. Àwọn areas kan wà bẹ́ẹ̀ yẹn tí ẹ̀rù máa ń ba àwọn teams yẹn láti lọ, ṣùgbọ́n àwọn èèyàn máa ń fún wọn ní extra sí tó bá ti pàgbà tó ń sọ pé lọ síbẹ̀ yẹn ó ní pé ó dangerous, fún ọlọ́pàá
àtẹ̀lé wọn lọ. Èdè ńkọ́, torí mo mọ̀ pé gà Haúsá wà, àgọ́ àwọn Ìgbò náà wà, ẹ̀ńtẹ̀ẹ̀dẹ̀ gbà bóyá ẹgbàá lómi tí mi ò gbà Haúsá dáadé bẹ́ẹ̀, báwo la ṣe ṣàlàyé fún pé
ìyẹn ti fa problem sẹ́yìn, ṣùgbọ́n ní ìsìn nǹkan tó wà ń bẹ ni pé ṣé àwọn tó máa ń gbé ògùn yẹn abẹ́rẹ́ àjẹsára yẹn káàkiri, ara àwọn community ni, kì í ṣe gbogbo wọn ní àwọn oníṣègùn àbí nurses àbí nǹkan bẹ́ẹ̀ yẹn. Àwọn community members ní tí àkọ́wọ́n bọ́ ṣe ń ṣe àdẹ́fún wọn ní ògùn yẹn. So tá bá ti fẹ́ ṣe àwọn tó máa gba abúlé yìí kọjá àbí abúlé yẹn, àmì ìṣọ pé ara àwọn tó ń gbé ń bẹ̀ àti alámú tàbí wọ́n sínú tíìmù yẹn tó máa káàkiri. So tó bá ti rí ara àwọn èèyàn tí wọ́n ń bẹ̀, ọkùnrin abalẹ̀ wọn á dẹ̀ gbà.
Láti gba àwọn tó sọ èèyàn kan ti wà lórí ìlà. Hello,
ẹ káàárọ̀ sir.
Ẹ mà káàárọ̀ o, kí lorúkọ yín?
My name is Honorable Babayemi from Ìkẹrẹ́wé local government.
Honorable Babayemi.
Ìkẹrẹ́wé local government.
Ẹ káàbọ̀ sórí ètò, kí ni ìbéèrè yín?
Mo kí kọmíṣánná wa sọ.
Ẹ káàárọ̀.
Wọ́n kú iṣẹ́ takuntakun.
Ẹ ṣeun.
Àmọ̀ràn kan tí mi kàn fẹ́ gbà wọ́n lórí ètò tí wọ́n ṣe lọ́wọ́ sọ. Ní ìjọba Ewékòró nítorí níbàyí, ní àdúgbò tẹ̀lọ́mí wọn gbé kíní ẹ̀ dídẹ̀. Mo bá rọ̀ ìjọba gbogbo wọn jọ pé tó bá ń ṣe irú nǹkan bẹ́ẹ̀ kọ́ ní ẹ̀dùn wọn máa mọ́nítọ̀ wọn, tàbí wọ́n dúró map gbogbo ibi tí wọ́n bá máa lọ fún wọn, nítorí àwọn tí wọ́n gbéṣẹ́ yìí fún at the end of the day wọ́n máa gba owó wọn. But àwọn aráàlú tẹ́lẹ̀ ní kọ́ ṣiṣẹ́ fún, they didn't do anything. Ọ̀pọ̀ ilé mi lè máa kọ́ tó máa dé, àwọn kan máa kọ́ chalk sára ilé, but they will not do anything there.
Where in Ewékòró is your own place, so that we can actually be specific? Hello?
Hello, sir.
Mr. Babayemi, where in Ewekoro is your own place? Where? Itori. Which area in Itori? Is it the entire Itori community or a specific place?
I'm talking about Ilopeju area.
Okay, Ilopeju area of Itori. Honorable Commissioner, you heard of that?
Yes. Sherry, wọ́n máa ń ṣe planning tẹ́ sọ pé ó yẹ kó máa ṣe yẹn, wọ́n máa ń ṣe yẹn kí ètò tó bẹ̀rẹ̀. Nǹkan tá à ń pè ní micro planning. Wọ́n máa ya every gbogbo àwọn títì àti gbogbo ibi tí àwọn settlement wà, wọ́n máa ya gbogbo ẹ̀, wọ́n á dẹ̀ pín sí lórí sí timetable fún ọjọ́ mẹ́rin yẹn pé nǹkan tá a máa ṣe ní ọjọ́ kìíní ọjọ́ kejì. Àwọn kan máa ń worry pé okay pé mo ti rí wọn káàkiri wọn tí wà sọ́dọ̀ mi, ó lè yẹ pé àdúgbò yẹn pé ọjọ́ kẹta àbí ọjọ́ kẹrin ni, ṣùgbọ́n bẹ́ẹ̀ ṣe sọ yẹn pé àwọn kan ti wá ṣùgbọ́n wọ́n kàn ya kílẹ̀ sára ilé wọn dẹ̀ ṣe nǹkan kan. Ó máa ń ṣẹlẹ̀ from time to time. Àwọn report báyìí ló dẹ̀ máa help wa pé ká tún lọ check pé ṣé wọn ṣiṣẹ́ wọn dáadáa, ṣùgbọ́n ọ̀rọ̀ monitoring yẹn a máa ń ṣe monitoring gan-an ni. Tó bá ti jáde báyìí tó bá ṣe àdúgbò kan báyìí tó bá ti kọjá sí àdúgbò mi, àwọn monitors wa wọ́n máa wọ àdúgbò ìkíní yẹn, wọ́n máa lọ check ọwọ́ àwọn ọmọ yẹn dẹ̀ ni wọ́n máa wò, torí wọ́n máa ń fi indelible marker wọ́n máa ń kún èékánná àwọn ọmọ èékánná ọwọ́ àwọn ọmọ tó ti gba abẹ́rẹ́ àjẹsára yẹn. So àwọn monitors yẹn wá wọnú ilé, táwọn èèyàn bá ti lọ́bẹ̀ tán bá ti kọ́ kíní sára lé, wọ́n á dẹ̀ bèrè lọ́wọ́ àwọn parents pé ṣé wọ́n wá sí bíbá yẹn, wọ́n ní àárí wọn, wọ́n á check àwọn ọmọ tí ò bá sí tí ò bá sí ọ̀dà yẹn ní èékánná ọmọ yẹn, wọ́n á report àwọn teams yẹn, wọ́n á dẹ̀ padà lọ wọ́n á lọ ṣe. So à ń ṣe monitoring fún láti cover nǹkan ti problem tó.
Tá bá wòye àwọn ọmọ tó lọ sọ́jà àsìkò tó lọ sọ́jà wọ́n ti wálé, wọ́n á lọ sọ́jà kóhun tó dé nígbà tó máa kúrò lọ́jà wọ́n ti dọ́jà, ìgbà tó máa délé wọ́n ti kúrò nílé. Bí kí ni ẹ ṣe ó máa ń ṣẹlẹ̀, kí ni àwọn èèyàn á ṣe.
Nǹkan tá a máa ń sọ ni pé a máa ń ṣe nǹkan méjì tó bá ṣẹlẹ̀ bí ó máa ń ṣẹlẹ̀ sometimes tó yẹ pé wọ́n ti ẹ̀ pọ̀ tẹ́ àwọn monitors yẹn rí pé ó ti pọ̀ jù tẹ́ ti miss níbẹ̀ yẹn, a máa ń ṣe nǹkan tá à ń pè ní mop up. Tí ètò bá ti parí a sì máa padà jáde pé lẹ́yìn Tuesday yẹn ó dé Wednesday Thursday a máa ṣe nǹkan tá à ń pè ní mop up tí wọ́n á tún padà jáde pẹ̀lú abẹ́rẹ́ àjẹsára. Ṣùgbọ́n tí wọ́n bá ti wá sàdúgbò yẹn tí ẹ̀dẹ̀ ti jáde tẹ̀tí bọ́mọ jáde tẹ́ wá padà tí wọ́n sọ fún pé
tẹ̀wárí ṣọ́ọ̀kì lára lé pé
wọ́n wá pé ẹ̀sìn bẹ̀, then nǹkan tó wà ń bẹ ni pé gbé ọmọ yẹn lọ sí ilé ìwòsàn wádẹ̀ fún yín níbẹ̀. Tẹ́ bá dẹ̀ lọ́kì ẹ lè kọjá wọn ní títì ní àdúgbò mi níbi tí wọ́n ti ń ṣe, wọ́n á fún yín, kò sí wàhálà.
Kì í ṣe pé bóyá mi ò gbàdúgbò yìí mo gbàdúgbò mọ béèyàn bá bá wọn lọ́nà pé
tẹ́ bá bá wọn lọ́nà tẹ́ fọmọ dání wọ́n á fọmọ yẹn straight kò sí wàhálà.
Do we have another call? Okay.
Hello. Hello. Ẹ káàárọ̀, kí lorúkọ yín? Kí lẹ ti porúkọ yẹn? Tósìn láti Alámùwà. Alámùwà yà, ẹ káàbọ̀ sórí ètò. Ẹ káàbọ̀ sórí ètò. Kí ni ìbéèrè yìí? Hello, alàgbà Tósìn. Mo ń gbọ́ yìí. Ẹ rí wọn ní ṣé gbogbo Adóodò lẹ́ẹ̀ ti rí wọn àbí ní Alámùwà?
Alámùwà kọta ní Òkèyìn ó sọ̀tà.
Ẹ tí ì rí wọn bẹ́ẹ̀. Ok, commissioner.
Ok, màá sọ fún wọn ṣùgbọ́n mo dájú pé wọ́n á débẹ̀. Ṣé rí àwọn areas yẹn tí èrò pọ̀ gan ni gómìnà wa ti fún wa ní owó díẹ̀ ká ṣe nǹkan tó ń pè ní extra teams. Ìyẹn ni pé àwọn èèyàn tó ń pín abẹ́rẹ́ àjẹsára yẹn pé kán pọ̀ ńlẹ̀ sí. So ní Adó-Odò Ọ̀tà àti àwọn local government tí population wọn pọ̀ gan ni àti ní extra teams. So ó lè pẹ́ wọn díẹ̀ o kán tó dé inú lọ́hùn kán dẹ̀ kárí gbogbo àwọn
èèyàn tó wà bẹ́ẹ̀
pọ̀ ṣùgbọ́n wọ́n á débẹ̀.
Ó dà fún àǹfààní àwọn tí wọ́n ti ẹ̀ ń wò wá wọn ò débẹ̀ àti rí wọn àárí wọn wọ́n wá parí ètò yìí lọ́la. Àwọn tí wọn ò bá rí wọn kí ni kí wọ́n ṣe?
Kán lọ sí hospital náà, kán lọ sí ilé ìwòsàn alábọ́dé tàbí kán lọ sí ibi tí wọ́n ti máa ń gba abẹ́rẹ́ àjẹsára fún àwọn ọmọ yẹn.
Kán gbọ́mọ lọ́bẹ̀.
Kán gbọ́mọ lọ́bẹ̀.
Ṣé wọ́n máa tún ní kán wá gba káàdì nígbà wọn bá débẹ̀? Tó jẹ́ pé abẹ́rẹ́ àjẹsára ló fẹ́ gbà fọ́mọ.
Wọ́n máa nígbàkúgbà wọ́n máa ń gbowó díẹ̀ owó káàdì but kì í ṣe pé abẹ́rẹ́ àjẹsára wọn ń sanwó ẹ̀. So ó bẹ́tà fún àǹfààní àwọn ọmọ kẹ́ ẹ lọ tó bá ní ẹ sanwó díẹ̀ ó káàdì àbí nǹkan ẹ ṣe kẹ́ fún àwọn ọmọ ní abẹ́rẹ́ àjẹsára ó pàtàkì gan ni so kò yẹ kéèyàn ní pé nítorí owó díẹ̀ pé wọ́n fún ọmọ ní.
All right, as we close to Honorable Commissioner, one word for parents, for guardians, for everyone.
Please remember that immunization plus days will not be with us forever. It is the responsibility of the parents to get their children immunized, to use the health service as it should be used, so that the government can stop spending money on immunization days and put it to other areas of the health service. Please take your children to be immunized as and when it is due.
All right, you heard it all there from the Commissioner for Health in Ogun State, Dr. Olaokun Soyinka, on the Immunization Plus Days exercise, which is ongoing across the Federation. But more specifically in Ogun State, he says you have a responsibility as a parent, as a guardian, and even as an adult to assist the children have a future that is poliomyelitis free. What you need to do is actually to get them immunized, and if by chance you missed out of this exercise, just move on to the nearest primary healthcare facility to you and get those kids duly immunized. Honorable Commissioner, we thank you for your time with us on this program. We wish you the very best in your effort. We go on this short break, and when we return, we shall be joined by a man of